Cardiovascular system diseases and disorders. You have these notes which provide a basic definition, but you can add to them so the assignment will be easier. Bradycardia, a slow heart rate, so less than 60 because normal is 60 to 100. Tachycardia is a fast heart rate. So if normal is 60 to 100, tachycardia is greater than 100. Myocardial infarction, that is a heart attack. That is a blocking of coronary circulation. So remember the coronary arteries and coronary veins that wrap around the heart to provide nutrients, oxygen, and remove waste from all the cardiac muscle itself. Well, if there's a blockage, cardiac muscle starts to die. Heart attack. Angina pectoris, that's chest pain. And that's often due to decreased blood flow to the heart. So not necessarily a complete blockage, but the heart isn't getting enough oxygen, enough nutrients. Atherosclerosis. So there's fatty deposits in the blood vessels. And this happens naturally as we age, but if we are less active or smoke or stressed or have a poor diet, the buildup of fat in our blood vessels continues. So a former student told me they remembered it like this: my father is fat. Why? Because here's the other type, arteriosclerosis, and it has the beginning a little bit different, but this is the hardening or thickening of the arteries. So the arteries get less elastic, so they don't stretch as much. So this can lead to increased blood pressure as the heart has to pump harder to move the blood through. Congestive heart failure. So in this case, the heart doesn't pump effectively, so fluid actually builds up in the lungs, okay? And this causes a thickening of the ventricle walls, which results in the heart pumping less effectively, so it becomes a circular process. Fibrillation is a rapid and irregular heartbeat. So first of all, it's got to be fast. Second of all, it's irregular. And there are two types. Atrial fibrillation is that rapid irregular contraction of the atria. And ventricular fibrillation is rapid and irregular contraction of the ventricles. Now, atrial fibrillation, also called AFib, is treatable. There are some things we could do to treat it. Ventricular fibrillation is going to require a shock to the heart because this will result in death if it's not corrected. Heart murmur. So remember, that's an abnormal sound created by swirling or swooshing blood, meaning blood moving in the wrong direction. So most of the time that's because there's a leaky valve. A valve doesn't close completely, let some blood move in the opposite direction. Myocarditis. That's an inflammation of the myocardium or heart muscle. It can be caused by infection, but typically the infection is not begun in the heart. It started somewhere else, like I had strep throat, and then the infection spreads to the heart muscle. Pericarditis is an inflammation of the pericardium. That's the sac that the heart sits inside of. A stroke is an interruption in blood supply to the brain, and here it causes brain cell death. So a heart attack causes heart cell death. A stroke causes brain cell death, neurons. So there's ischemic. That's a vessel that's blocked by a clot. Okay, so that's the most common type of stroke to occur, but we also have hemorrhagic strokes, and that's caused by bleeding in the brain, and that's definitely less common. There's Tetralogy of Fallot, and we're going to watch a movie called Something the Lord Made, and it is going to address this particular disease of the heart. This is congenital, meaning you're born with it. Babies are often cyanotic. Remember, that's a blue tint. And it's because some of the oxygen poor blood is pumped to the body instead of to the lungs to get oxygen. And it's called the Tetralogy of Fallot because there are 4 specific defects. So not 1, not 2, 4 specific defects in the heart in these babies. Varicose veins. So varicose veins are large, bulging veins. They can twist, they can cause pain and swelling. And this occurs because of damage to veins, either the valves in veins or the vein walls. Okay, in Raynaud's syndrome, the small arteries that provide blood flow to the skin constrict like more than they're supposed to in response to cold. So the tips of the fingers will appear white or bluish. And obviously, this is something that needs to be corrected. Oftentimes, people will put their hands into warm water to try to cause those vessels to dilate again and return the circulation. We have hypertension, that is high blood pressure above 120/80. We have hypotension, that is low blood pressure below 120/80. Now, there's a specific type of hypotension called orthostatic hypotension, and that's feeling dizzy or lightheaded, or in worst case scenario, fainting from a drop in blood pressure when you stand up. So sometimes you might stand up quickly, jump up, and feel a little dizzy or lightheaded, and that is because of orthostatic hypotension. Now, vasovagal syncope is losing consciousness due to a sudden drop in your heart rate and blood pressure, but it's not due to a change in position. It often happens when people skip meals in relation to strong emotions, overheating, even dehydration. This is more likely to occur in people who are taller, both vasovagal syncope and orthostatic hypotension. Now, calcium. Calcium is critical for the heart to function. So what if we have too much or too little? So if we have hypercalcemia, too much calcium, our heart can have prolonged, too powerful contractions. It can result in fainting. Hypocalcemia, where we have too little calcium, we have weak contractions. And in fact, the contractions of the cardiac muscle can even stop. Now, the effects of potassium. So hyperkalemia, too much potassium. The contractions are weak and may stop. So you can see it's a little bit reversed from the calcium. In hypokalemia, where we have too little potassium, we can have heart palpitations and irregular rhythm to our heartbeat. Aneurysm. So an aneurysm is a bulge in an artery due to a weakened artery wall. So the artery is supposed to have this path, but then we have a section where the artery is bulged out. Okay? Now, Mr. Miller had an aneurysm in his hand, and he had surgery. He shared the pictures, so here's a warning, but we're going to see what it looks like when there's an aneurysm. So here is that bulge in the blood vessel. There's the aneurysm. Okay, again, we can see here it is. There is the aneurysm. That is the bulge in the blood vessel. Okay, here, the aneurysm. That blood vessel is supposed to be nice and narrow, but you can see how wide it is in that position. Now, the danger of this is if it gets too wide, it can literally burst, and you're bleeding internally. That's hemorrhaging. Here you can see they're getting ready to remove this bulge, this aneurysm, okay, in the blood vessel. And here is what the incision looked like afterward. And there you have it, cardiovascular diseases and disorders. I hope you learned something new.